And I thank the Speaker for the recognition. I thank the Majority Leader for allowing me to participate in this hour this afternoon. May well be joined on the floor by some people who wish to speak on the very important occasion of the 3-year anniversary of the signing into law of the President's takeover of American health care, the so-called inappropriately titled Patient Protection and Affordable Care Act. I might just point out that I did attempt to have the word affordable stricken from the title 3 years ago, but I was overruled in that endeavor. It was indeed 3 years ago, March 21st, first day of spring of 2010. The first 3 months of 2010 had seen some pretty unusual activity here in Washington as this bill ground to its eventual rendezvous with destiny in the East Room of the White House on the 21st of that month. Many may recall that during the year of 2009, there were in fact some, at least what gave the semblance of some debate over here in the People's House, over here in the committees on the House of Representatives. But when this bill got over to the Senate, it was drastically changed. All debate was concluded, and then it was simply a matter of convincing enough Democrats to vote for the Senate bill, and it was eventually signed into law. I do want to spend some time going through the history of how we got here, because I do feel that that is important, and people need to understand how very bad process, how very flawed process gave rise to very flawed law, which now, 3 years later, as we see right on the cusp of the full implementation of this thing, is really going to have profound detrimental effect upon our country from the standpoint of our economy, our workforce, our job creation with small businesses. Certainly, the practice of medicine itself is going to be negatively impacted by the many, many pages of regulation that are now proceeding in a torrent from the federal agencies since the President's re-election.